If a person suffers from sciatica, pain radiating down the leg, surgical treatment is an effective treatment to free up a pinched nerve. We consider surgery if the non-operative treatment fails to resolve the symptoms. There are many ways to free up the pinched nerve. Microdiscectomy or endoscopic discectomy. Which one is better? Stay tuned. Hello everyone, for those who are new here, my name is Dr. Setiobudi, an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. Microdiscectomy or endoscopic discectomy, which one is better? Before I answer this question, let's learn the difference between these two methods. Both surgeries are designed to free up nerve impingement in people with herniated disc or slip disc. The jelly slipped out, pinching a nerve. The main differences are the size of the surgical incision and the equipment used. In microdiscectomy, the incision is about 1 inch or 2.5 centimeters. Because the incision is quite small, a microscope is used to give a better visualization so that we can see the nerve properly. In an endoscopic discectomy, the incision is even smaller, only 1 centimeter. One incision is used if we use uniportal technique and 2 incisions for biportal technique. We cannot even use a microscope. Instead, we use a camera or an endoscope for visualization. These are the technical differences between these two methods. But there is no significant difference between the healing process and the post-operative pain. The smaller the incision, the more difficult is the operation. Maneuvering the instruments is not easy with limited space. But does that mean that the success rate of endoscopic discectomy is lower than that of microdiscectomy? Not necessarily. The determining factor is the surgeon's experience. Endoscopic surgery is a relatively new technique. Doctors who do more endoscopic discectomy are certainly more skilled in this surgery than those who are just learning or those who are accustomed to do other methods, and vice versa. In principle, the higher the flight hours, the higher the success rate and the lower the complication rate. Personally, I'm comfortable and more confident with microdiscectomy. I don't do an endoscopic discectomy. I have learned this technique and I have some reservation about certain things. But this is just my personal opinion. I'm sure there are many doctors who are more comfortable in performing endoscopic discectomy. If a patient with sciatica or herniated disc comes to see me asking for an endoscopic discectomy, I will not do it. Instead, I will refer the patient to somebody else. But if allowed, I will choose to do microdiscectomy because I am comfortable and feel confident with this technique. So the patient must choose one, either the doctor, the surgeon, or choose the operation. For example, if you have chosen a doctor, then it is best to leave it to the doctor to decide what is best for you. If the patient chooses a particular surgery, then find a doctor who is comfortable to perform that surgery. The danger is that the patient chooses a doctor but also imposes the technique of surgery to the surgeon. It becomes dangerous if the surgeon adheres to the patient's request despite being uncomfortable with the technique. So it is dangerous. Endoscopic discectomy or microdiscectomy, which is better? It depends on the doctor who does it. Discectomy is just an example of many medical treatment that can be approached differently, but the principle applies to all medical treatment. I hope this information is useful to all of you. If it is, please give me a thumbs up. You can write some questions or comments in the comment section below. Thank you for listening, and don't forget to subscribe and share this video to your friend, and see you again in my next video. Bye bye.